Hello and welcome to the Malaria Notebook with me, Liliana Dayo. Today, I'll be talking about some of the decision errors that people make when they have fever. Welcome. So, what is fever? Fever is when the body temperature rises to 38 degrees Celsius or higher. On its own, it's not a disease, but rather it's a sign or a symptom of an underlying illness. Fever occurs when the immune system raises body temperature to fight infection, and it's actually the body's alarm system which tells us something is wrong and requires to be investigated. Fever is one of the body's natural defense mechanisms, and it helps protect us by slowing the growth and multiplication of disease-causing organisms or germs, and also activating the body's immune system to respond more effectively to infection. It also enhances the ability of the white blood cells to detect, attack, and destroy harmful microorganisms. So fever may be the first sign of many diseases. This includes malaria, pneumonia, meningitis, urinary tract infection, influenza, typhoid fever, amongst others. It could also be a sign or a symptom of viral diseases such as the viral hemorrhagic fevers, including the Ebola virus disease, which has been reported in some parts of Central Africa. And therefore, healthcare workers should never ignore fever. They are required to investigate through appropriate diagnostic tests and treat promptly to prevent severe illness and death. So some of the errors we make, especially in areas of high malaria transmission, is to assume that every fever is as a result of malaria. Not every fever is caused by malaria, and that treating every fever as malaria can sometimes delay the correct diagnosis and appropriate treatment. Also, unnecessary use of antimalarial medicines can contribute to drug resistance and wastage of valuable medicines. It's therefore always important that we test before treating whenever we suspect for malaria. It could be through malaria rapid diagnostic tests, microscopies, or PCRs in some instances. If the malaria test is negative, we are asked to investigate for other possible causes of fever and manage accordingly. Another error we make is self-medication, and that it's been reported that many people start taking antimalarial medicines as soon as they develop fever. And sometimes if the illness is caused by another condition, self-medication can only but delay the correct diagnosis and appropriate treatment. Delayed diagnosis can sometimes allow the disease to worsen, increasing the risk of severe complications and death. And therefore, treating yourself without knowing the cause of fever can sometimes do more harm than good. Also, delaying medical care is one of the errors that we experience, and it's important that we seek care early, since early diagnosis and treatment improves outcomes. Also important that we prioritize high-risk groups, especially children, pregnant women, and those with chronic illness, and also know some of the danger signs associated with fever. And this could include difficulty in breathing, convulsions, persistent vomiting, confusion, unconsciousness, or even inability to take anything orally. Early action saves lives, and therefore we should never ignore fever. Another error that is experienced is lack of compliance to treatment. And in this case, it's advised that we take every dose exactly as prescribed. And also, sometimes symptoms such as fever can improve before all the malaria parasites are eliminated from the body, and be very tempting for one to not finish the treatment. And this can leave some parasites alive, allowing the infection to return in form of treatment failure. So in the event that we vomit shortly after taking our medicine or experience side effects, we are required to return to the health facility for advice. And also not completing treatment can contribute to the emergence and spread of antimalarial drug resistance, and also can increase the risk of developing severe malaria. So also an error that we commit is to ignore prevention after recovery, and we are required to protect ourselves further after the malaria attack through sleeping under a treated bed net, and also removing all the breeding sites from our areas of stay. It could be through indoor residue spraying, larviciding, use of repellent, and also using malaria vaccination for children and fancider for pregnant women during their antenatal clinic visits. So when is fever an emergency? Sometimes fever can be accompanied by severe presentations such as convulsions, difficulty in breathing, persistent vomiting, and confusion. And this is an emergency that requires urgent attention by the healthcare provider. So on knowledge check, what is fever and why does it occur? And does every fever mean malaria? When should fever be tested for malaria? And what are some of the danger signs that are associated with fever that require urgent medical attention? Lastly, what are the common mistakes that we experience when managing fever? The key take-home message for today is that not every fever is caused by malaria, and it's always important that we test before treatment. We need to seek care early before the disease progresses into severe illness, and that we need to complete treatment as prescribed by the healthcare providers. Last but not least, to always prevent future malaria infections. Thank you for listening. Let's keep learning. Subscribe for more lessons from the Malaria Notebook. Let's fight malaria one lesson at a time.